pentuma papa efra so bra na wo dran ho na wo chiro ho dia na onuane Suzy stuffing ana oye wait oh that's it nakama ebia mawo
ma nimbisa wa sam kakra irisi wodan fofra odawa komanda no Kingsworld Furniture inyi haubiara Kingsworld Furniture yedensi nibiara na last stop tiles plastic non wooden ceilings burglar proof aluminium doors aluminium windows kitchen cabinets abua papa non tokra nyinara ebinye bi wo Kingsworld Furniture say asem do ye say pede yesi wodan na yesiesim ye furniture fittings na zinhinara zemaoza Fred 0249191139 and also 02081800041. Say ewo Amsterdam no Frekin and Mr. Arthur was 0031-685-808388 and also share your website www.kingsworldfurniture.com. Ibohu Kingsworld Furniture wa Putweja Lake Road. Kingsworld Furniture, perfect finishing.
Adofo amoshe Mrs. Amri. Menam Gamtv so. Ede aseda. Kesie. Ema adofo nyina. Eye ye mame Maros. Irade to nsa frɛ no. De mo be ye aso ebusua ene dodo. Efi ya wade, efi ada, kwesi ada, madaje, ne de mo hwiri bia no. Ejira Master Jesus anemu, ede aseda, ema adofo nyina. So for list, so nam, efidie so sesamre, ede aseda, emo bia. New better for. So for Alex and Emma Damase Ebusia Damase and Silnum Damase Adofo new battle Asafo say Master Jesus in Shram Dear Mube ye so for Alex say a brun in tears here so. Yami shirubia, de mushribia, erade, and shamanai. Eya sida, ne dema, Amsterdam fuinina, any other fuinina, amobe boye, and my your cry, ma miechi. Jesus, I adore your holy name. Feel like
Ladies and gentlemen, thank you very much for the opportunity to talk to you today. My name is Professor Charles Ajman. I work at Amsterdam Medical Center, University of Amsterdam. Today I'm going to talk to you about coronavirus. I know you've heard a lot about coronavirus for the last few weeks, if not months. But please bear with me for the next couple of minutes because coronavirus is certainly having a huge impact in all walks of life. People from all walks of life, including kings, prime ministers, rich, poor, adults, and children, have all been affected by the virus in one way or the other. As I speak, nearly or more than 8.5 million people have contracted the virus, and more than 500,000 people have lost their lives to the dreadful virus, according to the World Health Organization. We are seeing similar problems also in the Netherlands, where all people from all walks of life have always been affected by the virus. Unfortunately, we still don't have a vaccine, and that means that we need to do our best to protect ourselves and our families. It is equally very important that we get to know more to help us to keep safe. And that's why I want to talk to you today about the virus. Although we know that the virus affects everyone else, but what we've learned is that it appears that some people seem to be protected by the virus. And when they are actually attacked by the virus, they don't show any symptoms and they walk free. Whereas others, when they are attacked, they become very, very ill. They end up in intensive care, and some die very rapidly. So the question this raises is why is it that some people are so strong and able to withstand the coronavirus, whereas others don't? And what can we learn from these people in order to protect the whole society? So with these very important questions, the Dutch government contacted the Helios study team to try to help to find answers to some of these important questions that the virus is imposing in our society today. The government selected the Helios study because the Helios study covers the major ethnic groups in the Netherlands, including the Dutch, the Surinamese, including African and the South Asian Surinamese, Turkish, Moroccans, and the Ghanaian population. So clearly, this offers a very, very important opportunity to include all the ethnic groups in order to understand how the disease spread and what we can do in order to protect ourselves and our families. So in the coming weeks, you will hear from the Helios study team. And we will select those people that took part in the Helios study to complete a small questionnaire and also to provide a very small blood sample in order to help us to be able to answer some of these major questions that the virus is imposing in our society today. Unfortunately, those people that did not take part in the Helios study are not eligible for this study. I know that many people are saying, why not? You are doing this because the Helios studies already do have the baseline, which will allow us to be able to get more insight into the causes of the deadly virus. That's why we are only including the Helios study participants. So please bear with us if you are not included in this study. So those that have already been to the Helios Center for Measurement this year or last year are eligible and may be asked again to take part in this study. Those people that are about to come for measurement are also eligible and may be asked to take part in this study as well. I want to emphasize that those that are ill with the coronavirus or are showing symptoms are not eligible for this study, and they need to contact their GP as soon as possible if you have symptoms, please, or GGD. So those people that will be selected to take part in this study will receive a letter and a phone call to come to the Helios Study Center, which is next to AMC. I want to reassure you that the Helios Study location is absolutely safe, and there is no cause for concern for coming to the location for measurement. Strict hygiene and social distancing rules are in place. And I also want to take this opportunity actually to emphasize that AMC in general is absolutely safe. So if you need help, if you are ill and you need to come to the hospital for checkups and everything, please, please, please feel free to do so. Because the last thing you want is you coming to the hospital when you are absolutely ill. There is no need for that. The hospital is safe. What I want to say is that we need to fight the coronavirus together to protect our communities. After all, our health is our wealth. That is why it's so important that all communities in the Netherlands need to take part in this study to stop the virus. Together, you can fight the virus and win. So you can always contact us for questions if you do have some. Our televised program on the coronavirus is actually freely available. So you can always contact us if you need more information. For more information, please call 020-566-3792. I repeat, 020-566-3792. Or email us at info@heliosstudy.nl, or visit the Helios Study website, which is www.heliosstudy.nl. Thank you so much for the opportunity to talk to you today. If you work together, I'm pretty sure that we can actually fight the virus.
You're welcome this evening to this
So I wish you well. Please stay safe.
What is happening in the world
Thank
today.
you.
All of us are aware of the pandemic we are facing. And there are so many questions people are asking. There are so many misconceptions. There are so many things that are being pushed outside there because of social media. And it's great to hear that. So this evening, as specialists from AMC will be very helpful for us. I will advise chairman of PCC, and I'll be carrying it with this issue. Thank you. So I would like you to introduce yourself.
My name is Gamtv. Right now I'm working as a doctor at Vrouwkliniek Zuidoost. It's a gynecological clinic where we treat women, most actually women, and also part of the group that started Your Health is Your Wealth together with the PCC.
Well, my name is Moses Alade. I'm the chairman of Pentecostal Council of Churches. And a few years ago, we started this Your Health is Your Wealth with young professionals. And Dr. Akko is our project director. And today we are here to try to answer some of the questions our community are asking with regards to coronavirus crisis.
My name is Charles Ajman.
Professor Charles. Get used to it.
My name is Charles Ajman. I'm a professor in migration and health at Amsterdam Medical Center. And my work is mainly on looking at health disparities between the migrant population or the minority population and how they compare with the majority population across Europe, but mainly most of the work are done in the Netherlands.
My name is Vanessa Harris. I'm a doctor. I am a physician specialized in internal medicine and infectious diseases. And for the past couple of months, I've been treating corona patients in the Amsterdam UMC and the AMC. And I also do research on vaccines. And I'm looking forward to questions.
And the first question will go to you. What is COVID-19? How would you explain it to the normal person who doesn't know anything about this?
Well, there are two names that usually get thrown around. There's COVID-19 and there's SARS coronavirus 2, SARS-CoV-2. And SARS-CoV-2 is the name of the virus that causes the disease, which is COVID-19. So COVID-19 is a disease that comes from a coronavirus that is a new disease. We didn't really know about it until before December 2019. The disease is characterized by fever, cough, shortness of breath. Those are the main characteristics of people that get the disease.
Interesting. Dr. Charles, is there anything you can add to
I think she basically is the person who is working on it, so I think I have nothing to add. I think she's really pinpoint the whole.
Is COVID-19 man-made?
Man-made? Yeah. There are a couple of theories that it might have come from a laboratory in Wuhan. But from a scientific perspective and from the research that we've been able to look at about how the virus might have evolved, we don't think that it's man-made. We know from other coronaviruses, for example, the first SARS coronavirus that was more than a decade ago, and the Middle Eastern respiratory syndrome virus, MERS, which came out of the Middle East, that these are viruses that usually infect animals, and they can mutate, genetically mutate in animals, which makes it possible for them to infect other animals and, for example, humans. So the most likely chain of events that we think happened, but no one really knows for sure, is that SARS coronavirus 2 might have started in bats. Because bats have very interesting immune systems, which allows them to have lots of different viruses. And then maybe from the bat, the virus was able to spread to other animals. And because humans are more and more in contact with wildlife, we encroach a little bit on wildlife, that caused an interaction between humans and an infected animal, and that probably allowed spread to humans.
Interesting. So, animals can be infected as well?
Yes, animals can also be infected by coronaviruses. For example, one of the responses to the first SARS coronavirus was to close down wildlife markets. And the government has also been closing down wildlife markets now because they're worried that there might be circulating coronaviruses in wildlife that we don't know about.
Amazing. And one of the misconceptions also is about the G5 and COVID. Is there any relation between the two?
The 5G networks?
Yes.
Yeah. I don't know where that misconception, I don't know where it comes from. I think it's a really interesting idea, but there is no evidence that coronavirus spreads on 5G networks. Because actually a lot of countries that don't have 5G also have coronavirus.
I think that's a very, very interesting point, because one of the arguments was that only countries that actually implementing the G5 is where the coronavirus is happening. And they even specify that, for instance, Russia, coronavirus is not in Russia. But today, Russia is actually one of the countries which has been very hardly hit. Yeah. So that really disproves the whole concept of G5 actually being responsible. But I think if we put it in a very normal situation, how on earth is G5 is going to create coronavirus? Scientifically, it just doesn't make sense at all. There's no link. So far as you know, scientifically, there's no link.
Interesting. Because if you look at the number of masks that has been bent down, you ask yourself, how could people just go to that extent?
Yeah, I think 5G has its own health hazard. But linking into coronavirus, like the doctor said, there's no scientific proof. It has its own health hazard.
I think it's all comes down to misconception, of course. If people feel unsafe, people can do crazy things
And try to blame something.
if they feel unsafe. So if people really believe that this is what is causing it, and they have kind of, if you like, lack of knowledge about how these things work, then they tend to believe it. And when they believe in that, they take action, which might be completely unnecessary.
It's more or less a blame game.
Yeah, I think a lot of people right now don't know where Corona came or COVID-19 came from, and we're looking for someone or something to blame, that we can point that that's the cause of it or that's the reason it's there. And I think some people got the theory and then spread it around. And everything that is new is scary.
Was it from China, or the experiment was done in China?
The first reported cases of COVID-19 were in a seafood market in Wuhan, which is a very large city in China, and it happened just before Chinese New Year. And Chinese New Year, I lived in China for many years, but Chinese New Year is one of the biggest migration events in the world. There is no single period in the year where more people move around than the Chinese New Year. And actually there was probably a lot of COVID-19 disease before the Chinese New Year, and a lot of people carrying the disease, perhaps without knowing it, and moving to other places in the country and also internationally. So we think that viruses don't know borders. They infect people, and people, regardless of how wealthy or poor they are, what kind of ethnicity they have, everyone is vulnerable to a virus that they don't have any immunity to because it's a new virus. So we're all equally susceptible, and our global community facilitated the spread of this disease.
How does the virus spread?
Well, one of the things that I think is the most important, if you know a little bit about how the virus spreads, then you can protect yourself. So it's the kind of knowledge that perhaps can empower you. But the virus, it infects, first of all, the nose and the mouth, and the virus replicates so that when people sneeze or cough or talk really loud or even sing, where you're expelling a lot of air, you're able to spread the virus. And how easily it's spread is dependent upon how close you are to someone, because the virus is carried in droplets, and the droplets kind of fall to the ground. So if you're 1.5 meters away from someone, like I am from the professor, then probably even if I would cough, the droplets would land on the ground. But if he's close to me, then I could cough in his face, and some of those droplets could go in his mouth or his nose or his eyes, and that would allow the virus to infect him. So if the first thing you can do to protect yourself is to make sure that you have a big enough distance, and in Holland they say it's 1.5 meters, between two people to make sure that you're not infecting one another. The second is that if you're going to sneeze, clearly when you sneeze, air goes further, sneeze into your elbow. Another way that the virus is spread is that perhaps I'm sitting here at a table and I'm coughing and the droplets come onto the table. And then the professor is sitting next to me, he puts his hand on the table, on those droplets, and then he starts rubbing his eyes and his nose, putting them in his mouth. And that's another way that the virus is spread. From when you don't really know that something is infected, but you're touching it and putting it on your face. So that's why washing hands frequently and regularly with water and soap is a way of protecting yourself from inadvertently touching droplets, which are carrying viruses, and infecting yourself.
I have a question. How long will the virus last if it's on a hard surface?
Yeah, it's a really good question. We don't really know because a lot of the experiments are done in laboratories where none of the things that happen in real life happen. So they basically put a lot of virus on a piece of plastic and then wait to see what happens. But in real life, the sun is shining a little bit, or the water comes on, or it's disinfected. But there's a possibility that it stays for a little while. Yeah, so it's good to also keep your house clean, disinfect surfaces. Yeah.
Also to add that when you're washing your hands, just go for 2 seconds and I'm done.
Yeah.
So at least 20 seconds.
Yeah.
Then you know that you've cleaned your hands properly. And also while washing your hands, also in between your fingers, your thumb, is also your wrist.
Yep.
And you can go a bit higher if you know.
And the tips of your fingers.
Yeah.
Because those are the ones that come the closest. And if we do it in the hospital, we sing happy birthday. So if you wash your hands as long as you're singing happy birthday. Just don't sing happy birthday at someone.
Now, how long does the virus stay in clothes?
In clothes? We don't know. I mean, in the hospital, when we're treating a lot of patients and we are getting a lot of people who are coughing on us and things like that, we wear gowns because we know that it can get into the clothes, and then when you shake them out, it can get into the hair. But we don't really know how long it stays in clothes. I think the real risk for clothes is if you're in a home and someone is infected, that probably you don't want to be washing each other's clothes. But for me, walking by you and it being on your clothes, I'm not going to get it that way.
Okay. There is also another misconception that black people are not affected by COVID. How true is it?
I think I'll pick this one up. Actually, coronavirus doesn't discriminate on the basis of color. And it doesn't also discriminate on the basis of whether you are rich or poor. Actually, it's attacked many rich people. It attacked very people. You know, you all know that Prince Charles got it. You know, so many famous people. Exactly. So I think that actually, this is a complete misconception that the disease doesn't affect black people. Actually, what we are seeing is that now you're beginning to see that the black people are actually more affected compared to other populations. And this information is actually coming from the data from both United States and the UK. So the idea that the black people are immune turns out to be actually, how do I say, was a disadvantage. You probably also perhaps convince people that they are untouchable, and probably sort of did not protect themselves. And now we see that many of the conditions that you see today, black people are having a very hard time at the moment. Not only that, we also know that because you have the condition, but then you have what you call the severity. After you've actually got the infection, what the infection actually does to you. And you know that actually, for instance, the work coming in the UK shows that if you compare the people that die from the COVID, the African population or the black people in the UK, for instance, 4 times more likely to die compared to the white population.
And why is that?
I think that there might be a lot of issue around it. But before I actually answer that, we're also getting the same information. For instance, in the US, in some places, I think it's Chicago, for instance. You see the population of Chicago, the black people is about 30% of that population. But the death from the COVID-19, black people actually is composed about nearly 50% of that. So you could see the mismatch within it. But then that goes into the issue of why is it that the African population, but I want to emphasize that it's not only the African population. You're also seeing that other communities such as the South Asian population, like India, Bangladesh and Pakistani people, are also dying equally very much. So it appears that the minorities, but having said that, the black people have been the most affected, at least the data that we see from the US and the UK. The question then becomes, why is it that, like you put it, that this is affecting the African community so hard? I think that there might be several factors that you could put at play. First, if you look at the information we are getting, that the people that actually tend to have what you call in the medical terms the comorbidities. In other words, if you do have different health conditions, like for instance, if you have more diabetes, if you have hypertension, if you have heart diseases, if you are obese, your risk of getting the COVID is very, very high. And that also means that those people that do have these conditions are more at risk. And you know that many of these conditions are very, very problematic among the black or the minority population. I mean, the Healy study has taught us a lot. For instance, if you look at hypertension, if you take 100 people and put them here, let's say men, you take a black 100 people here, we are talking about nearly 50 of them having hypertension, compared to say just about 30 of the white population. You take obesity, even much more problematic. For instance, within the Dutch women, you just got about, say, if you are lucky, just about 10%. If you take the black woman, nearly 50%. So there is a huge disparities. And I think that this might be one of the causes. It's not only the cause, but one of the factors that might drive it. Another important factor that might drive it is also has to do with the fact that many of the minority populations, unfortunately, tend to be poor. And that means that they do the jobs that expose them more compared to the richer white population. For instance, you know that if you see what we see, bus drivers, for instance, more likely to be people from the minority population. If you have people delivering, say, food or working in a restaurant, it's tend to be the minority population. And that means that the infectious dose, even if they get more doses of it, because they get exposed to multiple people coming in. So there are multiple factors which might actually be driving this. But all these are just...
I'm interested in Poland here. What is the ratio?
Unfortunately, that is the issue that we are discussing now. And I think this is very, very important. This is the information that we are getting now. It's coming from the UK, it's coming from the US. So what is happening in the Netherlands? That at the moment we do not have data here yet.
Okay.
So you don't know what is actually happening here. But the Dutch scientific body have prioritized that this is a very important topic that needs to be researched. So we hope that within the next couple of weeks, the government will make it available so that we can actually start also putting data together to see what is going on. It is only when we see what is going on that we can actually start making basically more data to try and address the problem.
Now, compared to the number of, let's say, blacks in Africa, what is the ratio?
I mean, again, that comes down to data. You know, I mean, even within Africa, for instance, at the moment, what we know is that there's only 2 countries that is actually doing better in terms of the data collection. I would say South Africa and Ghana. These are the countries that are actually doing much to collect the data at the moment. And it also has to do with the issue of the resources available. I mean, to collect data, and this all comes down with resources. And many countries don't have that resources to just do that. But what we know, though, from the African continent, particularly if you go back to Ghana and other countries, is that although the condition for in Ghana, for instance, now they've detected about, say, 5,000 people or so, and I think it's only about 20 people have died. So actually, if you look at in terms of death coming out from the coronavirus, what we see in Europe and what you see in many African countries, so far is lower there. But this is an early stage. We don't know how that is going to turn out. So let's hope that, you know, it continues that way, because if it doesn't, remember that in many African countries, there is always a difficulty because there is no ventilators. I mean, America, the most richest country on earth, is struggling with ventilators. Imagine what is happening in a country such as Ghana, Nigeria, and others that are not as so rich as this country. So let's hope that.
This brings an interesting question I always ask myself. Now, we always talk about peak of the issue. How do you determine the peak? Because it goes up and comes down. How do you determine it?
I can speak for the Netherlands. What we saw is that the outbreak started in the south of the country. Probably it was driven by two major things. People having carnival, where you're going out late at night, people are singing, they're hugging each other, they're in close quarters, there are a lot of people together in bars, which probably spread the virus in that regional area. And then it was also spread in the Netherlands by people returning from vacation from Italy. That was quite hard to hit at the time. And that led to a big surge in infections. And of course, one person is infected and they infect 2 other people, and then that goes to 4 and 8 and 16, and that grows. And then the government started shutting things down, making sure that people have distance, and those efforts have really dropped the number of cases in the Netherlands. I can tell you in the hospital, I'm so relieved. We had 3 floors with 3 departments full of COVID patients. Now we have half a department. And the number of patients who are in the ICU have gone down dramatically. So our peak has gone down, but that doesn't mean that we can't get another peak. And so as people start to resume their normal lives, maybe it's harder for them to stay at a distance, people start to come together, probably there will be new waves of the infection, but how big those are and how many people will be affected, we don't know. But we do know that if we implement social distancing, that it can protect us because it can drop cases.
Interesting. Is there any medicine or vaccine at this time?
I really wish that there was. I really, really wish that there was. But right now, one of the hardest things in being a doctor, I have to say, is not being able to offer medicine to patients who are infected. And there are a lot of different medicines that are being tested. There are a lot of different medicines that people think work or think they should work, and politicians who think that medicine should work. But actually, as a physician, I only want to give a drug to a patient if it's been proven that it really protects them and doesn't hurt them. And right now, we don't have those medicines. At the same time, there are lots of companies and universities that are working on developing a vaccine. The vaccine is different from medicine because you would give it and then you would be protected from the disease. And that development is going really fast, much faster than vaccines for other diseases, for example, against Ebola. But that'll take definitely time. Vaccines are hard to make. That takes about a year.
One of the questions people ask in our community is, why is it that government doesn't allow people or make it a law that everybody should wear a mask?
It's a good question. And every country seems to be doing it differently. So I think that because this disease is only 5 months old, we know so little about it. And we also don't know the best ways to protect society. Masks, when I see a patient and I take care of someone who I know has corona, I wear glasses and a mask and a gown, and when I go onto the unit, I get dressed, and when I go out, I get undressed very carefully. I wash my hands like 20 times. But if I'm walking around outside and I'm feeling fine and my neighbor is feeling fine, is it appropriate to wear a mask? And some people, when they wear a mask, what they do is they put it on and then they wear it the whole day. And maybe you infected me and I got some of his droplets on my mask. And I've been wearing the mask for hours and I forget about it. And I take my hand and I go like this and I go like this. And then I pull the mask over my nose. And then the mask kind of pushes the droplets into my nose. So wearing a mask for long periods of time gives you a false sense of safety. Probably the best thing that a mask does is is that if I'm sick and I'm wearing a mask, it's less likely that I'll infect someone else. So that's why, for example, the government has asked that people wear masks in public transport, because there are a lot of people in small spaces, and you want to keep people who are infected from spreading it. They don't do it so much to have people be protected. It's really to keep from spreading.
And also people need to remember that you have to put the mask on correctly. That's also another thing, because I see a lot of people wear masks but they put it under their nose, then they're like, it's not that effective.
Yeah.
And also they're wearing the whole day, they're putting it on, they're off, they're touching it. So at the end of the day, the way it's supposed to protect is not even protecting anymore, because at the end of the day, you're more spreading it out if you're...
How do you put it on perfectly?
You have a sample for us to demonstrate?
A mask should fit, a mask should fit around your nose so that this is as close to your skin as possible, and that it covers this part of your face, because you don't want it to get into your nose and your mouth. And when you take it off on both sides, and you take it off this way so that you don't let the outside touch yourself. And when you take the mask off, you wash your hands. But the most important thing when you have a mask is not to touch your face. And the most important thing you can do to protect yourself is maybe not wear a mask, but just wash your hands a lot.
And if you know you're sick, stay at home.
And if you're sick,
that's the
don't go
most
outside.
important thing. Is if you know you're sick or you're not feeling well, or you suspect it or anything, call your GP to discuss it. They'll give you the advice. And also, if you're in doubt or anything, stay home. Because at the end of the day, if you're infected and you go out and you don't use the correct procedures, at the end of the day, you might be infecting other people.
Okay, if you are sick, stay home. There's another misconception also that when you go to the hospital and even you don't have COVID, they presume you have it, and then they'll just put you add you to the COVID patients. How true is that?
No, I think remember that the hospitals are there to save people. In the hospital, those people that are working there are highly experienced people. And I keep on saying that to those of us that travel many parts of the world, places like AMSE, Addis are one of the best hospitals in the world. I keep on giving us an example. Even the richer countries such as Saudi Arabia and others, when a very important person is sick, they ask them to go to this type of hospital because they know that they have the specialties here. So the fact of the matter is the people are there to support people. So if people are ill or sick and they need to go to hospital, it is very, very important that people go because there is a system in place. Even as Dr. Vanessa mentioned, even the COVID part, you've created a specific ward specific for that. So it's a completely separate from other part of the hospital. And you all know the AMC is a very, very big place. And so if you are sick and you need help, please don't stay at home and get soaked and then get more complication of your condition. Remember that, for instance, if you have heart condition and you need to see the doctor and you don't, it is going to get more complex. And if you don't take care, you're going to have a very bad outcome out of it. So the hospital is there to serve. The doctors, the nurses, and health assistants, they are all ready to assist people. So please, 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 this misconception is not helping anyone. And therefore, people should start using the hospitals.
adɔfo a mohwɛ me sesambre nam Gamtv so ɛde aseda ɛma adɔfo nyinara ɛde masi bebree abra erade
Everyone standing with hands uplifted. Hear it all.
Yawada, Ifiada, and Nipasiada. Osuada was Madajia was saying, the Bibia Mushri.
Sing it
This is a young man, the Dinamisha is seen. The dad of Funas, Tiampe, so sweet. Michina so far less and then wasn't if I sit down Yara
lifted as a prayer now.
Michina knew better as a fool and then I sit down Yara as I did why as I guess it's so far, let's say,
sweet Holy Spirit, sweet heavenly God.
Anapa ne isim so adasa. Yamena to make to a
Zagadat.
Yamena to make
sister, I know be your brider. Give me one chance, make I be a fighter, provider. Toto for my man, make I be a pasta. We need you team, make I be a sponsor.
Oyoko abusia panyin a wɔkyerɛ patre awayi ne mpaboa hyɛ abusia panyin barima owusu yeboa sana hene Holland barima kwaku dadie nana kwadwo nyantachi otumfo sana hene nana agyeman kromo asante hima chiame nana sewa po asante hima chiame nana abuajewa kokɔ homo hima ene oyoko abusia anamu ɛbɔ wonka yɛsɛ afe na bra so sɛ wɔyɛ nana owusu ano panyin a wɔtɔso miɛnsa kyerɛ patre hene a wɔkɔ akura yɛyɛ ne na ase asɔre ɛwɔ Amsterdam yɛn nanan ne ma a yɛnim wɔn ɛwɔ Holland ene onomonyamfoɔ Kofi Owusu dadeɛ nana ano adwoa kunadu dadeɛ anipa dodoɔ enim ne sɛ adwoa da Costa Gamtv adwoa jamfua dadeɛ ene afua acha ɔfaseɛfoɔ a yɛnim wɔn ene akwasifi anipa dodoɔ enim ne sɛ amanfoɔ akwasi Recording Radio Amsterdam onomonyamfoɔ kwabra apia anipa dodoɔ enim ne sɛ Gambra Den Hague asew a yɛnim no fa na ase asɔre ho ene yɛnnuaba Florence acha abusuan hyehyɛ ne sɛ yɛbɛyɛ yɛn nanan na ase asɔre August bosome no da ɛtɔso aduonu miɛnsa ɛda yi ɛyɛ kwasieda ɛwɔ Roman Catholic asɔre a ɛwɔ Hollandred address ne yɛ Millenhof number 158 ɛna postcode ɛyɛ 1106 TT efiri anopa non dubrem kɔpem sɛ awia dumienu ɛbɛbɔ yɛfiri na ase asɔre no so a yɛn nyinaa de ani ɛbɛkyerɛ Kingston Park no so yɛ de reception akotoa so wɔbrɛ a abɔ awia nomienu brem ɛkɔpem sɛ anadwo nonkron ɛbɛbɔ ɔsi yɛba a yɛnhyɛ black and white ekuo ahodoɔ ɛboa ma na ase asɔre abasoɔ ɛne All Saint Catholic Church St. Teresa's Blessed Trinity Men Fellowship Ghana Union Blessed Trinity Gamtv Lake Road All Friends are the best Trepatrefoɔ Mama Gata Adepamfoɔ Kingstonfoɔ Ɔyɔkɔfoɔ nananom a wɔte nkonnwa tuntum so ɛwɔ Ghana nananom a wɔdi wɔn nkonnwa ɛwɔ Holland ɛnamfoɔ nsɔrensɔre asɔfoɔ ɛne ankorankorɛ wɔso wɔto wɔn nsa frɛ Amsterdam nyinaa sɛ yɛmɛtaa wɔkyi ɛmoa wɔn ɛmoanyɛ wɔn nanan na ase asɔre ɛwɔ Amsterdam ɛnya ne kwankrakora wɔsi biribi ɛkye wadwea frɛ 0641488933 abusuan ɛda yɛn ase
Ma members wa asam kakra irisi wodan fofra odawa komanda no Kingsworld Furniture inyi haubiara Kingsworld Furniture yedensi nibiara na last stop tiles plastic non wooden ceilings burglar proof aluminium doors aluminium windows kitchen cabinets abua papa non ntokra nyinara ebinye bi wo Kingsworld Furniture say asam dawie say pede yesi wodan ni yesiesim ye furniture fittings na zinhinara zimauza Fred 02491911139 and also 02081800041 Say ewo Amsterdam no no frɛ Ken ana Mr. Arthur was 0031 685 808388 and also share your website www.kingsworldfurniture.com. Ibohu Kingsworld Furniture wa Putweja Lake Road. Kingsworld Furniture, perfect finishing.
To my papa, Efra, so bra, na would drown, na would strong, oh dear, na or no one Susie stuffing. Susie stuffing, and now, oh yeah, wait. Oh, that's it. Mama Susie, when you're at the a free school. Miniano, who are Obecasa a duku, but a yentoma. Said ye here, yes, see, I will born no. Yabu born a camera, and here could I say, Obata dear Nadia Shemu, dear would dear Hiana say, Obata pass and now the Akata who know what it. A woman different colors, and one as I would do for be. Our person would try, dear coach, would do for ye very important mouno. Bra, never jib in a facama. Like I said, any bad no, but there wasn't so. I knew I found Abba. True, me can't ever do with you. My Jimmy dear, and to so bra, never do with you. And we are near Dofo. Some at the papato. A can't percent just open to my papato. And I lace papato. And a material lining and the zip papato. Susie stuffing or Amsterdam spot. Shopper horn, Uko Habinia. Your people are being share. We are so lazy. Share. So, 1 year ago, say 2 years so. Not a papa blast. Susie see Obechepiama. Open when up at the body. And you know, home Susie stuffing. Now, remember the Umanyama Kwaswadi. So, I open to my papa, Efra. So bra, na would drown, na would strong, oh dear, na or no one Susie stuffing. Susie stuffing, and now, oh yeah, wait. Oh, that's it.
I was diagnosed with HIV 5 years ago. It was my nightmare becoming reality. I couldn't believe it, and I didn't want anyone to know about it. The only person I could talk to about was my doctor. My doctor helped me with understanding my condition better. I've come to learn that HIV is not a death sentence. I also learned that when I take my treatment every day, I can live a healthy life. I can no longer infect anyone else with HIV. I know now that my condition is not a threat to anyone else. That's why I feel free to share my HIV status. I told my sister about it, and she accepts it without fear. U equals U means undetectable equals uninfectious. I have HIV, but I cannot pass it on to you when I take my medicine. Don't fear me. I'm healthy. 'Cause you